Good afternoon. My name is Sumaya Al Kalla, and today I'm going to be talking about student engagement towards academic dentistry. So, in September of last year, um, prior to that, I decided to join the Academic of Dental Career Fellowship Program. That's our students are interested in teaching after dental school. So one of the things, and my mentor is Dr. Rachel Novak. So one of the main objectives of this fellowship is to basically uh, develop a career growth and leadership, understand the dynamic facets of medical and teaching principles, allows to reshape easy and complex information in an enthusiastic manner, and also make sure to understand the audience, or in that case, students, and their culture, and try to always regulate your teaching skills based on the generation that you are teaching. So I taught I taught in this class it's a biomedical science class that I taught, and it was mainly focused on the axial muscles. We focused on the muscles of the vertebral column, abdominal muscles, muscles of facial expression, muscle of mastication, anterior neck, and extrinsic muscles of the tongue. During lecturing, students at the end of the lecture had a optional survey that they can take in reflecting on that day's lecture based on my performance and how and their understanding towards my teaching. So one of the questions were, please set your level of satisfaction for the material provided during axial muscle lecture. Around 72 participated, around 50% 50 students actually were very satisfied with that. And that was a very pleasing information that I've received. And then in addition to one of the survey questions, it asked Sumaya Al Kalla was very knowledgeable about the topic that was taught. And around 72% of students participated. 55 strongly agreed, said 17 somewhat agreed. Now, in general, this experience of teaching 100 dental students was actually very challenging. I believe that becoming a dental student at Roseman University opened a new route in my career. It opened this opportunity of teaching is an amazing opportunity. The teaching culture at Roseman inspired me even more to teach and follow the education path. Reflecting on Roseman's six-point mastery learning model impacted me and influenced me to become an educator. One of the 6-point mastery learning models that primarily influenced me was the active and collaborative learning model. I like this concept because it pushed professors to assume the role of facilitators rather than typical lecture. Several activities, such as allowing students to read, hear, discuss, and reflect and study each subject in depth within a single class hour by having them engaged in discussion, case presentations, simulations, role acting, debates, and variety of other activities. Were also were also included, excuse me. In this way, a wide range of learning styles may be accommodated, and the concept taught by the teachers are reinforced, understood, and put into practice. Aside from the fact that it resembles how healthcare is given in the present day, I like this idea since it incorporates a team mentality. Students are encouraged and required to work together to produce more competent professionals who can collaborate with others. Students no longer they no longer have to compete with one another to get the top grades. With the knowledge of this model, I believe that I am confident that I will help equip other people, in this case, my colleagues, my long life colleagues, with appropriate dental and oral health knowledge, thus supporting dental education through teaching and research. Moreover, um, as as in the reflection during that day, after teaching on September 2022, an optional survey was given, as I mentioned. 72% of the class participated. There's 76% of the class strongly agree that I should teach, and 23%, 23.6 somewhat agree, and 0% disagree. That's an amazing outcome. The experience allowed me to be part of the new curriculum and dental coursework, allowed me to remind myself of content I might have forgotten or been updated over the years. Now, this whole study had showed me that that students actually learn from one another, and they learn better sometimes from one another than from a professor, a classic professor, and then passing down the information to student. So, as I mentioned earlier, you always have to regulate your teaching patterns based on the audience that are in front of you, and that's one thing that I've learned. First, one of other thing, first, I chose the head of neck anatomy because it is an essential aspect of dentistry. I'm interested in knowing the norm to differentiate from the abnormal anatomical features. Anatomy of the head and neck is essential for dentists as well, and dental assistants, as well as for the patients that we treat. I want to use this fellowship to recognize abnormalities, enhance diagnosis, design an appropriate treatment plan for the patient, and collaborate with other medical professionals. This is vital for a dentist. This is very vital for a dentist, of course. Second, I chose ADIA, ADCFP fellowship because I want to use this fellowship to help me in the path of academia after graduating from dental school. I am interested in helping the community in dentistry's clinical and non-clinical aspects. Third, I chose this fellowship because my education journey for the past 26 years, I always struggled in elementary school, high school, and graduate programs until I realized that there are structures and certain cultures that each professor have in the way they teach. Therefore, I have to learn and be able to regulate, as I mentioned, and manipulate my mind based on the class and the professor that is teaching. So therefore, here in this conversation, I'm putting myself as a student. So as a student, I always have to also regulate my mindset. Not only the professor teaching need to regulate their teaching skills. So in conclusion, I'm convinced that obtaining a degree in dental education and acquiring the inherent skill set will be pivotal in steering my chosen career path. The qualification will provide me with a broader perspective of the medical world's theoretical and practical concept, thus earning me a competitive advantage in the field of practice and education. Faculties that I interviewed are Dr. Callahan, Dr. LeCarey, and Dr. Angela Christensen. They guided me on how is it successful to be a professor, a dental professor, and seek an academic career in dentistry. And a special thanks I like to acknowledge, and I'd like to have a special thanks to Dr. Novak, who's always guided me through this fellowship and mentored me through a lot of either academic or life. A special thanks to her for always being so inspirational. So that would conclude my presentation. Thank you very much, and I hope you have a great day, everyone.